My name is Crystal Royster. I'm originally from Fayetteville, North Carolina. Been up here in Greensboro for 33 years. I came up here to go to nursing school. So me and Doris got something in common, except for, so I've been a nurse for 27 years, but I quit my job 5 years ago to do this, to still help people with their health care, especially seniors who need help navigating Medicare because Medicare can be confusing, right? Yeah. So I'm married with 24 years, no children. My focus on starting my business was to assist people and help them. Um, there may be some agents out there who try to take advantage of you. I'm not one of them. I don't consider myself a salesperson. I consider myself an educator because that's what I do. I educate you on your benefit options. And if you want me to be your agent, I'll be happy to help you and guide you to help make it easier on you because I love helping people. I not only sell Medicare plans, I also sell life insurance and annuities for people who want to protect their retirement savings from the market. So I do that as well. I do ancillary health products, like if you choose a Medicare Advantage plan and you want to close in the gaps of the copays that you have, I also can hook you up with a hospital indemnity plan. That can be like a reimbursement for you. So I do several things. I'm pretty much a one-stop shop person, except I don't do property and casualty, no homeowners, no car insurance or anything like that. So, but just mainly health and healthcare and retirement for seniors. Okay. So if y'all get out the PowerPoint presentation that you have in your goodie bag, there's a pen in the bag to take notes with because you might want to take some notes. Like my mom said, there's nothing wrong with getting educated. So you want to educate yourself. And we'll take questions at the end, okay? So on the very first page, who can tell me who's eligible for Medicare? 65. What about under 65? With certain disabilities. If you've been disabled under Social Security disability for at least 24 months, in your 25th month, you can qualify for Medicare. You'll get automatically enrolled in Medicare on the 25th month of you being disabled under Social Security. Okay. Also, you have to be a U.S. citizen or a legal resident for 5 years, and people with end-stage kidney disease, that means renal failure, someone who has to be on dialysis, in the 4th month of their dialysis, they automatically are going to be enrolled in Medicare as well. So it's not just 65 plus. There are some special situations where people will qualify for Medicare. Okay, next page. So who can tell me what Part A of Medicare covers? What does Part A cover? Hospital insurance, exactly. And then Part B covers, so that's everything outside the hospital, your doctor's appointments, your colonoscopies, your physical therapy, your medical equipment, all those things are covered under Part B, okay? But that's all Medicare is Part A and Part B, hospital and medical. That's what original Medicare is. Now there's 2 ways to choose your Medicare benefits. That's to keep original Medicare and purchase a prescription drug plan and a Medicare supplement plan, because Medicare only pays 80%. You're responsible for 20%. So for people who don't have a secondary insurance that picks it up for the payment, they usually get a Medicare supplement plan, which is a monthly premium to help fill in that 20% that Medicare does not cover. What, the Medicare supplement? No, Medicare supplement covers the gaps in Part A and Part B, which I'm going to get to in a few minutes. Yeah, but I'm just telling about 2 ways just to get your Medicare benefits. The first part is the original Medicare with a prescription drug plan, Medicare supplement. The only other way to get your Medicare benefits is to sign up for a Medicare Advantage plan. You see that box that says Part C? That's another name for Medicare Advantage. is Part C. So if you hear a commercial that talks about Part C, it's just a Medicare Advantage plan, private insurance companies like Aetna or Humana or United Healthcare. They bundle all your benefits under one plan. Okay, so you're not having to pay separately for a prescription drug or Medicare supplement. Yeah, but they're both, neither option is better than the other one. It just depends on your situation. Okay. C, it bundles all your benefits. It bundles Part A. Well, structured Medicare Advantage plans are structured just like a commercial plan from your job. There's co-pays and co-insurance for each benefit. But it cuts out the need to get a separate prescription plan and Medicare supplement plan, because you can only get that if you keep original Medicare. If you get Part C, which combines all your benefits, which is Part A, hospital, Part B, medical, and prescription drug plan, you don't have to worry about buying another prescription drug plan, because you only can have one anyway. And that's included in the Medicare Advantage plan. And Medicare supplement is not meant for people who have Medicare Advantage. It's only for people who choose to keep original Medicare, which is Part A and B. Okay? All right, next page, hospital insurance, which is Part A. Part A usually has no premium, okay? But I'm giving you the 2026 figures of Part A for the deductible that's on there. It was $1,676. It's going up to $1,716. This is original Medicare. That's the deductible for each benefit period. It's not a yearly deductible where you just pay for it for the year, then insurance takes over. This is for each benefit period, which is a 60-day window of your last discharge. So say, for instance, you were discharged from the hospital today. You were readmitted for something else different or something the same next week. You're still within that 60 days of your last hospital discharge. So you don't have to pay another deductible. But if you were readmitted in December, you're paying another $1,716 deductible, or you're going to be billed for it. I would say that. Right. And that's the purpose of buying a Medicare supplement if you're going to keep original Medicare, because that'll pay that 20% that Medicare does not, and also pay that Part A deductible for Medicare. But like I said, if you have another secondary insurance that works like a Medicare supplement, like TRICARE for Life, it will pick up that 20%. So it wouldn't be a need for somebody to have a Medicare supplement. So again, Part A, Medicare pays 80% once that deductible is reached, but there's still no maximum out of pocket that you will pay in any given year with Medicare without that Medicare supplement in place. It's just, they don't cap what out of pocket for your costs. You just keep paying whatever 20% of whatever medical bill if you don't have that Medicare supplement. Okay. So the next page is some things that Part A covers. So who can tell me some of the things that Part A covers? Mm-hmm. Mm-hmm. Surgery. Mm-hmm. All right. It's not all in. Mm-hmm. That's when you go and have blood drawn? Blood transfusion. Oh, transfusion. Mm-hmm. Yep. Blood transfusion, yeah. Labs would be covered under Part B, your lab work. Mm-hmm. Yeah, good question. Part B, which is the next page, that is medical insurance, and everybody has a premium for that. Unless you are low income and you get a Medicare savings program that will pay that Part B premium for you. It is based on income. So it's a simple application that you fill out, when you're turning 65 to see if you can get help with that Part B premium. And there's also extra help that gives you assistance with lowering your costs for your prescriptions. Okay, we'll talk about that a little bit later. But the standard premium for Part B every month this year was $185. As you can see, for 2026, it's going up to what? $206. And the annual deductible is going up to $288. So everything is going up. Yeah, they take your Part B premium out of your Social Security check automatically. You can have it set up, if you set up your Medicare.gov account, you can have it set up to come out of your checking account directly if you want to change it. But other than that, they're going to take it right out of your Social Security check. And that'll lower the amount of your Social Security check. Yeah.
Keep going up, we won't have nothing left.
Everything is going up. So we just take it one day at a time. And that's why I'm here to educate you to find out, if you qualify for extra help, because that'll help with the out-of-pocket costs. So again, after you pay that deductible, you're still responsible for 20%. Medicare covers 80. So the next page is what Part B covers. Who can tell me what some of the things Part B covers? Mm-hmm. Exactly. Doctor visits. Yep. This is under the medical part. And medical equipment is anything like wheelchairs and CPAP machines and oxygen, whatever medical equipment that you use every day. So, okay, so we talked about what original Medicare does cover. The next page tells us what it does not. So can anybody tell me what original Medicare does not cover? All the things that seniors need, right?
Then why doesn't it not cover it?
Because Part A is hospital and Part B is medical. They added no other provisions for coverage for those extra stuff.
That just in North Carolina.
No, that's everywhere because it's federal. Medicare is federal.
Right.
So this is across the board. No matter where you live, if you have original Medicare, you won't get any coverage for any long-term care, cosmetic surgery, massage therapy, acupuncture, glasses, dentures, hearing aids. But Medicare Advantage plans will. That's why they call it Medicare Advantage, because there's an advantage to getting extra benefits that regular Medicare does not cover. Okay?
I have a different one with the federal government.
You got dental and vision?
Dental and vision, federal government.
Okay, so you're straight. You're good. Yeah, you're fine. And you probably got great benefits too with that. Yeah, okay. So you wouldn't have to get a separate dental or vision or hearing plan or anything. So, okay. What? Medicare Advantage plans will cover extra benefits like dental, vision, and hearing. It bundles that all in one plan too. And there's some good plans out there. Yeah.
Oh, okay.
Yep. She's my poster child, Miss Debbie. And my assistant and my friend. So, but yeah, there's some good coverages out there, so I wouldn't worry about it. And that's the part where I come in, is I'll compare the plans with you. You'll get to see it on the computer screen yourself. We'll go over each benefit, each copay, and then at the end, you tell me which one you like, and I'll sign you up.
Oh, okay.
Mm-hmm. Yep. And I'm here for general guidance. After you get your plan, if you have specific benefits, it's always good to call customer service on the back of the card.
You know, like that you can call and change it, the different plans.
You can call me if I'm your agent and switch.
Switch over.
They're during different enrollment periods during the year, which we'll go over that in a little bit because we got an enrollment period getting ready to come up next month. So, all right. So the next page gives you the two options that I just went over with you about Medicare. So option one, just for repetition and understanding, is you keep your original Medicare, which is Part A and Part B. You buy a Medicare supplement plan to cover the 20% gap that Medicare does not cover. And you buy a prescription drug plan because you got to have drug coverage. If you don't sign up when you're originally eligible for Medicare, you get a penalty if you don't have any other coverage through your job or whatever. Okay, so you have to sign up on time. So those are the two ways: the original Medicare, Medicare supplement, prescription drug plan. Then the only option, path two, is to sign up for a Medicare Advantage plan that bundles your hospital, your drug coverage, your medical, extra stuff like dental, vision, and hearing.
That's a separate card.
It's a separate card than your Medicare card. Yep, you are right, Liddell. Good question. All right, so next page talks about Medicare Advantage plans a little bit. Some have monthly premiums, some don't. Some have annual deductibles, some don't. But it does limit how much money you spend out of pocket. Once I show you the Medicare plans, I'll show you the maximum out of pocket that you'd be spending for that year. That if you reach it, the insurance company will pay 100% of your benefits for the rest of the year. Okay, so it does limit your out of pocket expenses. All right, and it combines Part A and Part B and your drug coverage, and you have to live in the plan area. Okay, so the next page tells us what Medicare Advantage does cover. Who can tell me what Part C your Medicare Advantage covers? Yep. Yep. Vision and hearing. Yep, it does. So it covers more things than original Medicare does. Mm-hmm. Yep. There are some Medicare Advantage plans, for people with diabetes and or heart disease that caters to their health condition to help them manage their health condition because they know those medicines are expensive. And if they need that medicine, they're not taking it, they're going to be in trouble. So they lower the cost of the medications on those plans so you can take it and take care of yourself and be healthy. There's not in this area, there's no special needs plans for cancer, but the Medicare Advantage plans cover the benefits for that. Yeah, there's different drug lists. There's different drug lists for different Medicare plans. So it depends on what drug that you're taking. And that's where I come in. I'll get a list of your medicines. I get a list of your doctors. I'll tell you each plan is different as far as how much it will cover and what drugs they will cover. And that is a plan that is not a Medicare Advantage plan. Medicare Advantage plans are set up totally different with their drug coverage than a commercial or individual health plan. Yeah. So it just depends on what medicines you're on that we'll review, and I'll recommend maybe the one that maybe costs you the least. Right. Okay. So I'm gonna go over special needs, like we were talking about, the special needs plans. There's two types of special needs plans in this area of the Triad or Greensboro, North Carolina. There's dual complete plans or dual special needs plans. Those plans are for people who have both Medicaid and Medicare. So it's based on your income, your age, and your disability. I'm not going to say everything, but it has low cost for people with low income. So if you, oh, you did? Well, you can be on Medicaid under age 65 because Medicaid is not the same as Medicare. Medicaid is a state-funded insurance that if you're low, this is federal. Medicare is federal, so they're totally different. But they can work together if you have Medicare and Medicaid together. Medicaid will pay your Medicare cost share for people who have full Medicaid. There's different levels of Medicaid. So if you feel like you qualify and you're getting ready to turn 65, you need to apply for full adult Medicaid 65 plus because you don't want family plan and Medicaid and in your 60s, you're done raising your family. You have to make sure they're putting you on the full adult Medicaid, the kind that will pay for your Medicare costs. I don't have it now, but I had it when I was in. Okay. And every state is different with their Medicaid program. If you have full Medicaid will pay for your Medicare costs. Okay. If you have partial Medicaid, that will only pay for your Medicare Part B premium. So there's full Medicaid and then there's partial Medicaid. The other special needs plans is called the chronic condition special needs plans that Miss Debbie here was talking about. It's for people who either have diabetes or some type of cardiovascular heart disease. And under that category of cardiovascular disease are a list of diseases with your heart, not just a heart attack. It could be other things too. Those are some good plans because it supports you with your health as far as extra benefits. And I can't speak much on benefits, but it gives you more benefits because of your health condition to help you stay healthy. Okay. All right. Any questions about the two special needs plans that I just went over? Okay. There's going to be some changes for 2026. It used to be that people who were on both Medicare and Medicaid and they was in a Medicare Advantage plan, they automatically got the over-the-counter food card. But for next year, because of all the cuts that's being done to both Medicare and Medicaid, there's going to be some cuts to you have to qualify for that food card only if you have a chronic illness now. Hypertension and cholesterol is one of them, two of them. But there's a whole list that I have that I'll review it to see if you qualify before I recommend it to you. Okay. So those are some of the changes for next year. Any questions about that?
So that it exists that who be having online.
You have to qualify for it. Like I said, if it does exist. No, it does exist, but it's good. It's best to work with the local agent,
Right.
because the trust that's built around that relationship, and local agents are usually aware of what type of plans are in the area. Instead of someone that's in California or India or wherever they may be calling from, so it's good to work with the local agent. It has its benefits. Okay. Now, prescription drug plan on the next page. And this is only if you are keeping original Medicare and have to get a prescription drug plan in addition to the original Medicare. Some have premiums, some don't. Some have an annual deductible, some don't, but it limits your max out-of-pocket spending, and that's also provided by private insurance companies like Aetna, Humana, Blue Cross Blue Shield. Okay. There's only two ways to get prescription drug coverage through Medicare. That's if it's included in your Medicare Advantage plan, or you get a prescription standalone plan if you keep original Medicare. Okay. Only two ways. Okay. Now, there were some changes that happened this year with prescription drug plans. I don't know if y'all remember hearing the donut hole or coverage gap. Okay. Once you get to a certain dollar amount spending for your prescriptions between you and what the insurance company pays, you went into this donut hole. Like when you reached $5,000 some dollars out of pocket, instead of having a set copay, you had to pay 25% of that drug, which could be hundreds of dollars. Then when you reach another 3,000, which is a total of 8,000 some dollars, you go into a catastrophic phase where you pay nothing. But by that time, you're kind of broke, you drained. So Medicare did away with the donut hole for 2025. They did away with the donut hole. So no more donut hole. And they lowered the max out of pocket from $8,000 to $2,000. So that means if you're on some expensive brand name medicines, you could reach that catastrophic phase just in a few months where the insurance company will pay 100% for the rest of the year. Right? Yep. So that part is good. No more donut holes, and it caps your prescription drug spending to $2,000. That was the change for 2025. Another option for those who may not qualify for extra help with your prescription costs and who need to spread out their payments for their prescription costs throughout the 12 months of the year is a prescription payment plan. Now, say you're on a medicine that costs $200 some a month, and you spread that, you 250 times 12, whatever that is, and you divide it by 12. You have a monthly payment for that prescription drug plan so that you can afford to take that medicine that you need. So that's the other change for a prescription drug plan. And the insurance companies should contact you about that if they see that you're on expensive drugs, or you can reach out to the insurance company yourself. Okay? All right, so on the next page, it just showed you a chart on the next page. Yeah, it just showed you a chart. Oh, go ahead and flip. Yep, go ahead and flip. Uh-huh, because that's just what I just covered. That's the chart that compares what happened with the prescription drug plan versus what happened in 2025. You see that coverage gap in the pink box in the catastrophic phase. Coverage gap went away. Now it's just 3 phases of prescription drug plan. You have a deductible phase. If that plan has a deductible, that's the first money you pay out of pocket before the insurance company will cover their part. After you pay your deductible, you have a set copay until you reach $2,000 out of pocket. If you reach that $2,000 out of pocket between what you and the insurance company pays, you go into the catastrophic phase where you pay zero. The insurance company pays 100%. You see that? Okay. Now, there are some changes to the prescription drug plan for 2026. If you are a person with full Medicaid and you have Medicare, there's 5 tiers to drugs. 5. Tier 1 and 2 are always generic. Tier 3 and 4 are brand name. Tier 5 are specialty drugs, like for people with maybe rheumatoid arthritis who needs a Humira injection or something. The first 2 tiers, generic, if you're on full Medicaid, $0 prescription, okay, for your costs. If you are on tier 2 and you have full Medicaid, you could be paying anywhere between $1.60 to $12.65. That's not on there. I just want to let you know about the changes for next year. That some people were used to all their prescriptions being $0 if they had full Medicaid or whatever like that. Now it could be anywhere between $1.60 to $12.65 for tiers 2 through 5. Tier 1 is always going to be 0, the lowest, cheapest generic medications. Tiers 2 through 5 is going to be anywhere between $1.60 and $12.65, but it still keeps your copays low. Okay? Any questions about that? Okay. So in 2026, Medicare raised their prescription drug deductible at $615. That's the max that a company can put their deductible on. Some are lower than that. $615 for the prescription deductible. That's what Medicare set as the highest that any plan can set for a deductible. There's some plans who have lower than that, but that's just the maximum that a plan can do. $15. Okay. And just like I said, that the max out of pocket for this year was $2,000. Well, Medicare has raised it up by $100 for next year. $2,100. Yeah, for the max. I know they lowered it from $8,000 to $2,000, but then you're gonna add $100 on the max out of pocket. I said I asked at an agent meeting that I went to. I said, is that gonna slowly creep back up to $8,000? Because they done lowered it.
Eventually.
Now it's creeping back up again, but it's still lower than $8,000. So we'll take it at face value for what it is today. And so Medicare can negotiate drug prices with the drug companies. So they have a list of common medications like Repatha, Eliquis for blood thinners, Ozempic, Mounjaro, the things that people have who have heart disease or diabetes, expensive medicine they need to take. There is a list that the insurance companies and the drug companies are negotiating for lower prices that people need. So that's done at the higher federal level. Okay. Turn to the next page. It should be a chart to compare Medicare, original Medicare, to Medicare Advantage. Again, it's a personal choice. Everybody's situation is different. You'll see all the check marks under Medicare Advantage as far as hospital stays, doctor visits, preventative services like colonoscopies and flu shots, prescription drugs, dental, vision, hearing benefits, and it limits your out-of-pocket costs. With original Medicare, You see it covers hospital and medical and preventative services. No protection for out-of-pocket costs. And it doesn't cover prescription drugs, vision, dental, or hearing. So for the ones who like the freedom to go to any doctor who they want to without a provider network, most of them choose the original Medicare and get a Medicare supplement. And then they buy a separate prescription drug plan and a separate Medicare supplement plan. So everybody's situation is different. Next, enrollment periods. Next page. This is very important, so listen up. You'll be 65 in January. So your enrollment period starts 3 months before you turn 65. So your enrollment period starts October, okay? And that includes a month of your birthday, January, and 3 months after you turn 65. So when does your initial enrollment period end? April, you got it. High five. All right. There's some other enrollment periods that we all need to be aware of. What enrollment period is coming up in October, starting in October?
I know it's for me, I have to enroll.
Yeah, open enrollment for anyone that's on Medicare starts October 15th, ends December 7th. That's when anyone with Medicare can join, add, drop, switch Medicare plans, Part D plans, or go back to original Medicare and get a prescription drug plan. You can do that as many times as you want to. I don't see why you would do it several times.
I thought there was a stipulation we're going from the Advantage back to the original Medicare. That they're gonna basically have to do another physical check on you as far as your health and your medical. Or is it?
For the state, I'm glad you brought that up. For the state of North Carolina, if you have been on the Medicare supplement plan and you can no longer afford it because the premiums go up every 12 months and you want to try out a Medicare Advantage plan, there's a 12-month trial period.
What about original Medicare? If I'm on original Medicare, but I want to switch to Advantage, I figured this is not working. I want to go back to original Medicare. Can I do that?
Yes. During open enrollment, you can sign up for a Medicare Advantage plan. When January starts, because your plan that you sign up for during open enrollment starts January 1st. By the end of January or February, and you don't like that Medicare Advantage plan and you want to go back to original Medicare, you can drop it between January 1st and March 31st.
Never knew that. I was always told go back.
Yes, you can. You can drop the Medicare Advantage plan and pick up a prescription drug plan if you need to. But for you, you wouldn't have to pick up a prescription drug plan because you got it through TRICARE for life. But if you want to try a Medicare Advantage plan to see how it works during open enrollment, and if you don't like it, you can drop it and go back to regular Medicare. You're not stuck because those two different open enrollment periods. Yeah. And so October 15th to December 7th is for everybody with Medicare to add or drop or change or switch or whatever like that. January 1st through March 31st are for people who only have Medicare Advantage plan. They can do a one-time switch, or if you're looking at the paper, you can disenroll from the Medicare Advantage plan, return to original Medicare, and add a prescription drug plan. Okay, for people, like I said, who was on a Medicare supplement and they couldn't afford it, they just didn't like it anymore, they want to try a Medicare Advantage plan, there is a 12-month trial period for you to go to that Medicare Advantage plan. If you like it, fine, stay on it, but you have up to 12 months where you can go back to your Medicare supplement without no underwriting, without no health questions. Okay, still it's a guaranteed period, which a lot of people don't know, but it's good to know that, to know what your options are. All right, so on the next page is special enrollment periods. There are several special enrollment periods. If you just got out of prison or incarcerated, there's a special enrollment period to sign up for Medicare. If you have become eligible for Medicaid, there's a special enrollment period to sign up for a special needs plan. For that, okay? If you lose Medicaid or lose extra help or lose your Medicare supplement, lose your Medicare savings program. All of those are changes in your Medicare status. So you have a special enrollment to switch to a plan that better suits you. If you're enrolling in a 5-star plan, you can do that anytime during the year by using the 5-star enrollment period. And there's different reasons where you have a special enrollment period. A lot of people are choosing to work past age 65 because they want to get that money and they want to get that full retirement benefit at age 67. So if you're working past age 65 and you have health coverage through your job, you have a special enrollment period to sign up for Part A and Part B with no penalty. So that next page about how do I enroll in Part A and Part B, it gives you options between automatic enrollment in the Medicare and then when you have to enroll on your own. So if you're already getting your Social Security check, or if you've been disabled for 24 months and you got, disability for the 25th month, or you got ALS, which is a neuromuscular disorder, you will automatically be enrolled in Medicare. Those are the 3 ways that you can be automatically enrolled in Part A and Part B. If you're not getting a Social Security check and you're not disabled, you have to enroll on your own. I recommend enrolling online. That's another benefit of setting up your Social Security account online. You can look at your earnings and see how much you would get at different ages for your Social Security check. You can check and see what your monthly benefit is for your Part B, for your Part A. And you can also apply for Medicare online, and you can apply for your Social Security check online too. It's a way to manage your Social Security benefits. If you have that login, you can manage your Social Security and your Medicare benefits and everything. And it's best to do that. Otherwise, you'll make an appointment in person with Social Security, which could be, you might have to wait a while before you can get in. And then when you call, there are long wait times because they are short staffed. So the best way to apply is online. You can't even walk in anymore. They don't take walk-ins. You got to set an appointment. So if you can get your own Social Security account online, you can apply for your own stuff, your own benefits. So the next page talks about assistance programs. And this is very important because it's based on income to help lower your Medicare costs. There's 3 different types of programs. There's extra help that has to do with lowering your prescription costs. There's the Medicare Savings Program. That's where partial Medicaid pays your Part B premium. And then there's full Medicaid that pays for all your Medicare costs, covered benefits, okay? All right, so the next page goes into detail about each one of these programs. Extra help is also known as LIS. It's based on your income, as you can see. These are assistance programs for people who have Medicare and maybe have low income, okay? Extra help, also known as LIS, which is low income subsidy. It saves you on your prescription drug costs. You remember when I was going over those prescription drug costs for people with extra help, you will pay no more than between $165 and $12.65. That was that range. You won't have to pay hundreds of dollars if you have extra help and you can get it, okay, for your prescriptions. The second one is the Medicare Savings Program, also known as partial Medicaid. That's where Medicaid pays your Part B Medicare premium for you. Also based on income, it's an application you can do online. Social Security, ssa.gov/extra help. It'll take you directly to that website. I would say go ahead and apply for it now to see if you qualify, because if you do, that'll save you some money on your Social Security check because Medicaid will be paying it for you for the Part B premium, okay? Now, Medicaid is the most comprehensive coverage when it comes to paying your Medicare costs. Full adult Medicaid works with your Medicare by paying your Medicare costs for your benefits. So it assists you with your health care expenses, okay? On the next page, it tells you the income limits for the extra help. for prescriptions. If you're an individual, no more than $1,976 a month for income. For couples, no more than $2,664. So you think about your own financial situation, what you got coming in. If you think you qualify, go ahead and apply. Even if you don't think you qualify, go ahead and apply. What's the worst thing they can say? No. But they could say yes. So in some of these situations, they give a $20 leeway in your income if you're within that $20 of that maximum income. Okay. The next page is the income requirements for individuals and couples for the Medicare Savings Program, the one that pays your Medicare Part B premium. There's 3 different categories that you can fall in to get partial Medicaid. That's the qualified Medicare beneficiary. You look at the income for individual and couples on that and figure it out. And then there's specific low income Medicare beneficiary. That's the middle one. Look at the individual income and the couple income. And there's a qualifying individual. You look at your individual income and then the couple income. So this is for your information that if you know your income is below that, whether you're married or single, you know whether or not you can apply for it anyway, because you never know. If you can get that help, go ahead and get it, because it will help cut down on the Medicare costs. They raised it up a little bit for 2026 for the Medicare Savings Program. Let's see, for 2025, it was $13.25. They raised it to $13.38 for 2026. For the Slim B, specific low income, they raised it from $15.85 for individual to $16.01. And then for qualifying individual, they raised it from $17.81 to $17.98. So it gives you a little bit more leeway in there. If you have TRICARE, you're getting ready to turn 65 for Medicare, TRICARE requires you to sign up for Medicare because TRICARE works like a Medicare supplement. They'll pay secondary, Medicare pays first.